Hi, I am Dr Bornali Datta, and I will be discussing the treatment of drug-resistant tuberculosis with you. Drug-resistant tuberculosis, the diagnosis is made after drug susceptibility testing. This can be done by molecular diagnostics or by culture. It is important to have this information before any regimen is started. The treatment for drug-resistant tuberculosis has undergone a paradigm shift in the last few years. We have with us available newer, different, simpler regimens which are often all oral and do not use injectable at all. For drug-resistant tuberculosis, the domestic or national guidelines as well as international guidelines must be consulted before starting any regimen. In the current scenario, injectables are no longer recommended by our government. We have tried to use all oral regimens because of the severe side effect caused by injectable medication, mainly in the form of hearing loss. Many young TB patients who with drug-resistant TB suffered complete hearing loss, and this led on to a lot of advocacy to stop the use of injectable medication and therefore prevent hearing loss in young and older patients of drug-resistant tuberculosis. However, the rollout of all oral regimens haven't yet happened all over the country, and therefore sometimes we do continue to use injectable anti-TB medications, but we have to inform the patient about the potential side effects and consequences of this. The duration of treatment for drug-resistant tuberculosis can be anything between 18 to 24 months. However, again, newer regimens allow us to complete this treatment within 9 to 12 months, which has been a big change. The common medications that are used amongst injectables are called second-line injectables: amikacin, kanamycin, capreomycin. There is ethionamide, there is cycloserine, there is levofloxacin, moxifloxacin, and there is PAS and clofazimine. In patients who have MDR, pre-XDR and XDR, the current regimens include newer medication like bedaquiline and delamanid. These are available only in specialized government centers that deal with tuberculosis or tertiary care tuberculosis centers of the government. Certain specialized private healthcare centers, like for example Hinduja in Bombay and Medanta Hospital in Delhi NCR, have taken on the role of being DRTB providers. They have therefore access to these specialized medications like delamanid and bedaquiline for patients. So this is important for patients to recognize, because many patients insist on continuing their treatment from private healthcare rather than government. So a mix of private and public sector is available now to provide the best healthcare for drug-resistant tuberculosis vis-a-vis the latest medication that is available. Treatment with drug-resistant tuberculosis is difficult for two reasons. One is that it is a very lengthy treatment. Now we have brought it down to 9 to 12 months, but earlier it was 18 to 24 months. The side effects associated with these medications is severe. There is liver dysfunction, kidney dysfunction, there can be neuropathy of the nerves, there can be auditory loss or hearing loss, there can be vision problems and joint problems, severe joint problems. So these are a big deterrent for the patient to take the medication and to complete the medication. How can we help? First of all, it is important to confirm the patient's diagnosis as drug-resistant tuberculosis, because the entire treatment plan will be based on that. Secondly, we need to inform and educate the patients about the treatment and the follow-up. We need to help them manage the side effects related to the treatment, which are often many. Monitoring requires regular weight check, clinical checks, symptom check, etc. We also need to warn them that there can be potential dysfunction of the liver, the kidney, auditory, ocular, neural sometimes. This requires regular monitoring of blood tests pertaining to liver function test, kidney function test, thyroid function test, audiometry, eye checkup, and sometimes nerve checkup as well. In the case of extrapulmonary tuberculosis, sputum tests cannot be used to confirm that the drug-resistant bug is no longer there, we may need to do weight checks and symptom checks for them. We need to empathize with the patient, listen to the patient, listen to their concerns, the side effects they are facing, and link them to support networks whenever and wherever possible. Finally, we need to provide them with an access for counseling. Counseling is as important as the medication to help them tide over the period of treatment. Remember, the right treatment and a supportive environment is what will determine whether the patient is able to fight and defeat drug-resistant tuberculosis. Thank you.